I used to always blame my skin on stress and bad luck, until one slow morning when I realized the tiny salad I'd been skipping was actually the one thing that made my skin calmer. Good morning, I'm Samnang. Today we're testing kitchen-to-skin practices that are simple, affordable, and safe. Try one thing this week and track it for 2 weeks. I promise, small, repeatable acts add up.
And I'm Fiona. We'll bring science into the kitchen. What nutrients move the needle for skin? How to make a Skin Nourish Grain Bowl? A cooling aloe cucumber mist? And a couple of gentle topicals you can try. We also have Dr. Maya Patel, a dermatologist, and Lena Ruiz, a clinical herbalist, to ground this in safety and practical herbal wisdom. Download the patch test guide and the 2-week skin journal from our show notes before you cook along.
Quick note before we start. This is low-dose, kitchen-forward work, not a replacement for medical care. If something spreads, hurts, or weeps, see a professional right away. We'll say that again later, but I wanted to put it out there now.
Absolutely. Let's begin by understanding what's actually happening in common skin concerns so listeners feel understood and not overwhelmed. Skin complaints usually trace back to 3 things: barrier dysfunction, inflammation, and excess sebum or clogged pores. Barrier dysfunction means the outer layer of skin can't hold water well. That shows up as flakiness, tightness, or sensitivity. Inflammation, which can be triggered by diet, stress, or irritation, looks like redness or bumps. And acne often combines inflammation with clogged pores and sometimes bacteria. The good news is that food and gentle topicals can support barrier repair and reduce low-level inflammation over weeks, not overnight.
That makes so much sense. I remember a week when I cut back on processed snacks and added a handful of walnuts and a citrus salad. My skin didn't transform overnight, but it felt calmer after a couple of weeks. That's where small changes win.
I love that framing. Clinically, we expect modest, steady changes from diet and topical home care, usually several weeks. Red flags I want listeners to hear: a rapidly spreading rash, skin that's warm, tender, or oozing pus, sudden swelling of the face or throat, or large, painful cystic acne. Those are situations where you should pause home treatments and seek care. Over-the-counter topical hygiene and gentle moisturizers are fine alongside food-first approaches, but serious infections or severe cystic acne need professional evaluation.
Let's unpack nutrients that actually support skin. Omega-3 fatty acids help reduce systemic inflammation and can change skin oiliness and redness over a few weeks. Vitamin C is essential for collagen synthesis and wound repair. You get it from citrus, bell peppers, and leafy greens. Zinc supports immune function and wound healing. Good sources include legumes, pumpkin seeds, and oysters for those who eat seafood. Blood sugar control matters too. Lots of refined carbs can increase inflammatory signaling. These are food-first recommendations, not high-dose pills unless a clinician recommends them.
In traditional kitchens, we use turmeric, fermented foods, and cooling herbs to keep skin calm. Lena, tell us how culinary herbs can be part of both the grain bowl and the topicals.
Thanks, Samnang. Culinary herbs like cilantro, parsley, and fresh turmeric are anti-inflammatory and bring antioxidants. Calendula and chamomile are gentle and can be infused into oil or water for topical use. When we use herbs in food and in low-dose topical sprays, we're leaning into their mild bioactive profile, not concentrated extracts. For topical demos today, I'll keep everything simple: small batches, clear dilutions, and a reminder to patch test everything on the inner forearms first. And one quick safety point from the clinical side: some botanicals can sensitize skin, especially citrus oils and certain essential oils. Keep it simple for the face. Diluted aloe, cucumber water, and oat-based rinses are low risk. If you have a history of eczema or allergic contact dermatitis, consult before trying new botanicals.
Bridge time. Before our cook-along, here's what you'll need on your counter, and a quick patch test reminder. Pause and gather these items now if you're cooking with us. Prep checklist: a small pot, a cutting board, a microplane or grater, a bowl for mixing, a jar for dressing, a mug,
and a teaspoon for stirring. For topicals, a clean spray bottle or small jar, a fine strainer, and paper towels. And the patch test. Apply a pea-sized amount of any new topical to the inside of your forearm. Cover with a small bandage, wait 24 hours, and look for redness, swelling, or itch. Stop if anything unusual appears. Okay, Skin Nourish Grain Bowl. Let's cook. I'll read each ingredient slowly so you can jot these down. Lena, feel free to note swaps.
I'll chime in with swaps, especially good for people with allergies or limited budgets.
Ingredient list for one bowl. 1 cup cooked whole grain. We like brown rice or quinoa. 3/4 cup cooked chickpeas. 1 cup mixed leafy grains. Half a medium sweet potato, roasted and diced. 1 small avocado, sliced. 1 tablespoon pumpkin seeds. 1 tablespoon chopped fresh parsley or cilantro. For the dressing, we'll make 2 tablespoons olive oil, 1 tablespoon apple cider vinegar, 1 teaspoon grated fresh turmeric, 1 teaspoon grated ginger, half a teaspoon honey or maple syrup, a pinch of salt, and pepper. Optional, a squeeze of citrus for vitamin C.
Quick note on why. Whole grains give B vitamins and fiber for blood sugar balance. Chickpeas add zinc and plant protein. Sweet potato is rich in beta-carotene, a vitamin A precursor. Pumpkin seeds bring zinc and healthy fats. The dressing adds anti-inflammatory compounds from turmeric and ginger and healthy monounsaturated fat from olive oil, which helps nutrient absorption.
Step-by-step assembly. Step 1, start with 1 cup of warm cooked grain in your bowl. Step 2, add the cooked chickpeas and roasted sweet potato. Step 3, tuck in the mixed greens and sliced avocado. Step 4, sprinkle the pumpkin seeds and chopped herbs. Step 5, whisk the dressing in a jar and pour over the bowl. Step 6, taste and adjust. More citrus if you want brightness, more salt if it tastes flat. Take a breath. Notice the aroma. Turmeric and ginger should have a gentle warmth.
If you can't find fresh turmeric, use 1/4 teaspoon ground turmeric instead. If you're allergic to nuts or seeds, swap pumpkin seeds for roasted chickpeas for crunch. For budget swaps, canned chickpeas, rinsed and warmed, work perfectly.
Serving tip. Eat this alongside a vitamin C-rich fruit or squeeze a whole lemon over the bowl to support collagen pathways. For best skin effects, aim for a pattern. 2 to 4 meals like this per week and track changes over 2 weeks.
Now the anti-inflammatory herb dressing demo. I'll read ingredients slowly. 2 tablespoons extra virgin olive oil, 1 tablespoon apple cider vinegar, 1 teaspoon Dijon mustard, 1 garlic clove minced, optional, 1 teaspoon fresh grated ginger, 1 teaspoon fresh grated turmeric, 1 tablespoon finely chopped parsley, salt and pepper to taste. For a creamy version, add 1 tablespoon of plain yogurt or mashed avocado. Step 1, put the oil, vinegar, mustard, garlic, grated ginger, and turmeric into a jar. Step 2, add the chopped parsley, close the lid, and shake vigorously for about 10 seconds. Step 3, taste and season. Step 4, store in the fridge up to 3 days. Shake before using.
If fresh ginger or turmeric are unavailable, use a half teaspoon ground ginger and 1/4 teaspoon ground turmeric and whisk thoroughly. Pregnant listeners should check with their clinician about regular high-dose turmeric use. Our culinary amounts are low and usually fine, but it's a good safety habit to check when pregnant or breastfeeding.
Bridge to topicals. We'll make 3 gentle recipes: oat milk cleanser, aloe cucumber hydrating mist, and a quick oat honey soothing mask. Follow the patch test instructions we mentioned before you put anything on your face.
First, oat milk cleanser. Ingredients: 1/4 cup rolled oats, 1 cup filtered water, 1 teaspoon glycerin, or a teaspoon of olive oil if you prefer. Benefits: oats are soothing, contain avenanthramides that calm inflammation, and are naturally lipid balancing when blended gently. Step 1. Blend the rolled oats with 1 cup of filtered water until smooth. Step 2. Strain through a fine sieve or cheesecloth into a clean bowl. Step 3. Add the glycerin or olive oil and stir. Step 4. To use, dampen your face, pour a small amount into your hands, and massage gently for 30 seconds. Rinse with lukewarm water. Make only a small batch and store in the fridge for up to 48 hours. Patch test first on your inner forearm.
A quick safety note: homemade emulsions lack preservatives, so keep batches small. Use clean utensils and discard if it smells off. For those with compromised immune systems, check with your clinician before using any homemade topical.
Aloe Cucumber Hydrating Mist. Ingredients: 1/2 cup aloe vera juice or inner gel blended with water then strained, 1/4 cup chilled cucumber water, blend cucumber with a little water and strain, 1 teaspoon vegetable glycerin, and a sterile spray bottle. If you can, use distilled or boiled and cooled water for safety. Step 1. Combine the aloe and cucumber water in a clean bowl. Step 2. Add glycerin and stir. Step 3. Pour into a sterilized spray bottle using a funnel. Step 4. Label and store in the fridge for up to 5 days. To use, close your eyes, spritz 2 to 3 times from about 8 to 10 inches away, or apply with a cotton pad. Always patch test first.
Final topical, Quick Oat Honey Soothing Mask. Ingredients: 1 tablespoon finely ground oats, 1 teaspoon raw honey, 1 teaspoon plain yogurt or water to thin. Benefits: honey is antimicrobial and humectant. Oats soothe. Yogurt adds mild lactic acid for gentle exfoliation if you tolerate it. Steps: Step 1. Mix oats and honey. Add yogurt to reach a spreadable paste. Step 2. Apply a thin layer to clean skin for 8 to 10 minutes. Step 3. Rinse gently with lukewarm water and pat dry. If you feel stinging or burning at any point, rinse immediately and don't use that ingredient again. Patch test first.
Important clinical guidance on patch tests and contamination. Apply the patch in a clean area of skin, leave it covered for 24 hours, and check for delayed reactions up to 72 hours. For storage, homemade products without preservatives should be kept cold, in small, single-use portions if possible, and discarded quickly, 48 to 72 hours for most aqueous preparations. If you notice increased irritation, spreading redness, warmth, pus, or swollen lymph nodes, stop home treatments and contact a clinician.
Also, a short note on interactions. If you're on topical or oral medications, retinoids, topical antibiotics, blood thinners, check with your clinician before adding new botanicals or supplements. Some herbs affect drug metabolism. Our show notes include a brief herb-drug interaction checklist.
How to test it and what to track. If you'll try one demo this week, use our 2-week skin journal. Track these metrics daily: redness on a 0 to 5 scale, hydration from 0 to 5, breakout count, sleep quality, and one food or topical change you made. Take one photograph at the start and one at day 14 in similar light so you can compare.
Realistic timeline? Expect subtle shifts in 2 to 6 weeks for dietary changes and topical rituals. Immediate calming can happen with soothing topicals, but structural changes like improved barrier function take time. If after 2 weeks you see worsening or new painful lesions, pause and talk to a clinician.
Reflection. I want listeners to hear this. Pick just one thing this week. Make the bowl once, try the mist, keep a tiny journal. Start small. Trust the process. You don't need a perfect routine to see a difference.
And our practical takeaways: 1. Food first. Aim for omega-3s, vitamin C, zinc, and stable blood sugar patterns. 2. Keep topicals low risk. Short ingredient lists, small batches, proper dilution, patch test. 3. Track for 2 weeks and be realistic about timelines. That's where meaningful change lives.
Final clinical thought. Home care is empowering and complementary, but it has limits. If you have severe acne, recurrent infections, or rapidly changing lesions, please seek professional care. Don't delay treatment when the signs are there.
And from the herbal side, source fresh herbs when you can, keep records of how a plant affects you, and favor culinary doses over concentrated extracts unless guided by a trained practitioner. Simple rituals create consistency, and consistency creates results.
We'd love to see what you made. Try one demo this week, take a before photo, and share your result. Tag Earthy Remedy on social or send a 60-second voice note. Tell us which recipe you tried and what you noticed in 2 weeks.
Download the Patch Test Guide and 2-week skin journal from the show notes. If you want the full written recipes and sourcing tips, they're there. follow, and subscribe so you don't miss the downloadable resources and future episodes focused on skin-supporting meals.
Thanks to Dr. Maya Patel and Lena Ruiz for joining us, and thank you for listening. Listen to your body. Trust the earth. Feel the difference.